Hello everyone, you are all welcome to lecture number 1342, and today's topic is the sudden death of young adult by heart attack. This is very serious matter globally, and recently there are lot of research papers, and once I have gone through those papers, I have found that what statistical data they are giving, that if there is massive heart attack in young, I call them adults or young people in the age group of 25 to 30, 40, their survival rate is very less and it is very dangerous as compared to if the same type of heart attack is there, massive heart attack in senior citizens who are above the age of 60, 70 or even 80, their survival rate is more. So they are at less risk as compared to young people. So this is a very surprising to understand the factor that why it is not possible, or the youngers are at high risk of massive heart attack as compared to senior citizens in the age group of 60, 70. And generally people they say, of course I am a professor of medicinal chemistry, not cardiologist, but these publications are concerning everybody. So at least with the help of this social media, we can discuss this issue and the common man can understand the reason. What are the factors? So generally people they talk that your actually high risk hill is once you cross 50 and 60, then your risk of heart attack is less. This is general perception and people are talking. And according to them that if it is very young age, if you get massive heart attack, you are at high risk. So what is the factor behind it? And let me make it very clear. You know, there are arteries. First, our heart is blood pump. It is pumping blood to our all part of the body, including brain, leg, hand, and also to your heart. And it is receiving and again it is releasing. So there are branches of arteries, mainly two branches. One is left side, other one is right side. And they are supplying nutrient and blood to our heart muscles. That's why heart muscles are functioning. And in case if there is any blockage in that your heart arteries which are supplying either left side or right side, and let me make it very clear as per the publication what they have mentioned in research publication, that 60 to 65% blood supplied to our heart muscles ventricle is from left arteries. This is very important to understand. Our left artery, which is supplying blood to our heart muscles to survive, to function, to work, is from 60 to 60%. And our right artery, which is supplying blood to our heart, is only 15 to 20%. And rest is some other branches. So if in case somebody is unlucky, youngster, if they have serious blockage of their artery, that is left one, then 99% high risk is there, because it means 65 to 60% blood is blocked. It's not reaching to your heart and your heart muscle will die and definitely it will stop. As compared to if there is blockage in your right artery which is supplying blood to your heart, then there will be problem in only 15 to 20% of your heart, and at least you can survive. So the survival rate of heart attack, it is, you can discuss this issue with cardiologists, they know very well. If it is in the case of heart, left arteries are blocked, it is high risk as compared to right one. Now, why it is very dangerous or high risk for youngsters? I can give you the example of banyan tree. Banyan tree means in our area we call it bargat ka peड़. The tree of bargat, banyan tree. And if you see, they have lot of secondary root that is called prop or pillar roots. They are developed in very old banyan tree, not young one. And once they are developed and very strong with ages, maybe within 100, 200 or 80 years time, then if you cut the main root or stem of that bargat tree, banyan tree, it will survive because the branches are supplying the nutrient from the soil. The same thing is happening to our young citizen. In the case of young citizen, if suppose blockage is started in either left or in right arteries, so it is not one day affair. Slowly it starts. So the moment it starts, the blocking, immediately collateral capillaries and branches of arteries will start developing, and enough will be developed so that even if it is completely blocked, in the research paper it is given, there are cases when 99% or 100% blockage of arteries there, but by that time in senior citizens, a lot of collateral branches are developed and they are supplying the blood to the heart muscles and they are living normal life. That is called natural bypass rather than the surgical bypass. That is, we can say, artificial. We are making the grafting and bypassing that root and giving some branches. But that is already done by Allah or God or Bhagwan, whatever you believe. So nature is supplying, but that one, collateral branching and supplying of the blood for survival, instead of the fact that there is 90%, 80% blockage in your main arteries, left and right, still you are having normal life without any surgery, is because of the development of collateral branches of arteries, and that one is taking care. So I am just going to show you some images. So here you can see very clear picture of left and right arteries which are supplying to your heart muscles, and the left one is supplying from 60 to 65% of your heart muscles, whereas the right artery which is supplying to your heart the blood with nutrient to function is only 15 to 20%. You can see here very clear picture of blockage, and once there is blockage in either left or right arteries, there are lot of branches. They are known as collateral branches of arteries, and these collateral branches which are developed in years time, then he became 70 or 80 year old and his 98, 97% main left or right arteries are blocked. Even then they are doing normal work and they are not getting any heart attack. It is, I call it natural bypass, means Almighty Allah has given bypass to survive, but this type of collateral development of arteries is not in all, it is rare. So in case if there is identified on the basis of angiography the blockage, better to go for bypass surgery and follow your advice or diagnosis of cardiac surgeon. So young adults, they are just like this banyan tree, young tree, and these young trees, that is bargat tree, in Indian language, bargat, don't have any branch. They don't have any prop branches or pillar branches. So the youngsters, their heart is just like this young trees without any prop branches or collateral branches. So same banana trees, that burger trees, once they become very old, maybe 80, 100, 200-year old, then lot of several prop roots are developed. They are known as pillar roots. And if you cut the main root, these branches will supply the nutrient and it will survive because it has got lot of prop, that is called secondary branches of roots which are developed. This is the image of maybe some, because this burger tree, it can be 500, 400-year old. So in the case of very, very old trees, these prop branches of roots, they are so dominant or prominent developed that there is no need of main root. They are taking care of the whole tree. This same scenario is there in the case of senior citizen. Once they are left or right, arteries are blocked, and by that time lot of collateral branches are developed and they are taking care of supply of blood to their heart muscles. So here I have given those factors in the form of summary just to explain them for a preventive measure. Number one, sudden cardiac death, that is called SCD, in young adults is a devastating and often unexpected and very painful event. It's very much painful to family members, to relatives, to friends, and it is defined as a sudden unexpected death due to cardiac arrest within 1 hour of onset of syndrome. So this type of massive heart failure, heart attack in young adults, and they die within 1 hour onset. So that is very painful to all the family members, and lot of research papers are there and they have identified the factors. The main factor is that young people are at high risk of heart attack because they don't have collateral development of arteries to supply nutrients and blood to their pumping machine, that is called heart muscles. Then number two, why young adults are more susceptible to heart attack death due to these factors. It is mentioned, it is from those publications. Number A, lack of collateral blood circulation. Main factor is, if they have collateral branches to supply the blood to their heart muscles to function, then you are covered. So in those cases where these collateral branches are not well developed or are not developed that much, it's all genetic factor, or we can say it is from nature or from Almighty Allah, that in some cases it is developed, well developed, prominent, lot of branches. You have seen these photograph. They are well protected, but it doesn't mean that everybody will be developing. No. If you have any blockage in the main arteries like left and right, whatever is your cardiac surgeon or cardiologist are advising or diagnosing, just follow it strictly. B, underlying cardiac conditions. Some people are having underlying cardiac conditions, but it is not known. That is high blood pressure, mental tension, stress, sugar problem. So these are all underlying conditions is also there, that is contributory factor in young adults to get massive heart attack and where they are not surviving. The C is poor cardiovascular healthy lifestyle. We call it poor, they call it, those publishers, that they have poor lifestyle, cardiovascular lifestyle they call it, means they are smoking, they are alcoholic, they are not sleeping well, they are always in tension, in greed, in lot of problem. That is very, very poor lifestyle. It is non cardiovascular lifestyle. Then the collateral arteries and aging. Collateral arteries and aging, they have very strong link, because with the age there will be development of collateral arteries, small capillaries and branches that will supply to heart muscles, but it is not well developed in all cases. In some cases it is not prominent to supply, sometimes they will be at high risk. But those who are surviving and not having heart attack, instead of fact that their main arteries are blocked, is because of development of collateral blood capillaries and arteries. And then aging means develop arteries as alternative routes for blood supply in the case of blockage. Number 3, preventive and management steps. What steps you are supposed to take which can prevent and how you can manage. So it is a healthy lifestyle. I have already told you, smoking, alcoholic, and very bad sleep, rough life, easygoing, lazy-going, sedentary life. Be physically active, smart, do exercise. B, regular exercise and physical activity is very important to develop the collateral arteries. C, understanding your genetic family history. That is very important. You dig out your father, grandfather's history of cardiovascular problem. That will help you. And if they have a strong cardiovascular problem, please go for regular checkup, angiography, and some other stress test. So that will find out what is the condition or position of blockage in your arteries. So my one experience I am sharing with young adults. Your lifestyle matters. Don't take for granted and following non-cardiovascular, non-healthy lifestyle, smoking, gossip, not sleeping, spending lot of time in front of TV or your mobile phone, all this. Please regulate it. And I used to say one thing. Our heart is working for us 24 hours. It is not stopping even for a second. It is working for us to supply blood, just like blood pump for 24 hours. How much you are working for your heart to maintain? If it is zero, then definitely one day you will be at high risk. So if your heart is working 24 hours to pump the blood, to supply the blood to all part of your body, organ, brain, then you should work at least for 20 to 30 minutes, stretching exercise or just walking, so that your blood circulation is having good flow and your heart muscles are getting very good nutrient and blood to be healthy. So please, you should also work for your heart at least 15 to 20 minutes. With this, I will stop. Thank you very much for watching the lecture.